Good morning, everybody. My name is John Simoes. I am here on behalf of Protect Our Care New Hampshire. And once again, I have the research director from the Fiscal Policy Institute, Phil Sletten, joining me for a conversation today about one of those things that impacts so many people in our state, working families, businesses, small businesses, but we haven't talked enough about, but is at risk because political action needs to be taken and needs to be taken soon. Not to say that our congressional delegation in Washington hasn't discussed this and hasn't worked on it. They are, and they've kept this very much up front. But it's important for us as the people of New Hampshire to talk about our health care and the ability of our neighbors to have access to good preventive care. And I know, because Phil, I'm one of those people who gets the health care tax credit under the Affordable Care Act. We get our family's health care from the ACA. I'm very grateful for it. And it's very good for me, I'll tell you. I run my own business. My wife works in education. She's getting her PhD. We have two sons. One is in grad school, the other's about to go to college. So, everybody's got to get covered. Everybody needs health care, but I think as anyone listening knows, the cost of health care unfortunately doesn't come cheap. So having a little bit of help, in our case, it's a few $100s a month. But what that lets us do is to go to a higher level plan. So we have optical care, so we have dental care, and so everybody gets what they need or need from our health institutions, our partners, our hospitals, the eye doctor, the dentist. It means a lot to us, and I know it would hurt to have that taken away because then the money has to come from somewhere else. In our case, it's going in all kinds of directions out, not coming in as much. So, Phil, thanks for joining us. I wanted to share my story, but I wanted to ask you. How have the current health care tax credits under the Affordable Care Act impacted families and businesses here in our state? And what would the consequences be if they were either ended abruptly or not renewed by the end of the year?
Yeah, so thank you for having me. It's great to be back. So there are a couple different layers to these tax credits that we're referring to, and I want to unpack those a little bit for folks. So under the Patient Protection and Affordable Care Act that was signed into law in 2010, so going back a decade and a half now, the federal government took a few key steps to try to expand access to health coverage. Now, I'm going to mention three of those steps here. That's not a comprehensive list. There were many different facets of the Affordable Care Act beyond what I'm going to discuss here. But these three items, I think, help frame what role the tax credits play in accessing coverage and particularly reducing costs for individuals. So first, the Patient Protection and Affordable Care Act expanded Medicaid coverage to cover adults with very low incomes. Previously, kids with low incomes and older adults generally had access to some form of public health coverage already. So this expansion of Medicaid covered adults aged 19 to 64 with incomes near or below poverty levels. And this is when we refer to Medicaid expansion or when we refer in New Hampshire to the Granite Advantage program. This is the key component of Medicaid that we're referring to. And then second, after that, the federal government set up health insurance marketplaces, sometimes called exchanges, that provide an organized venue for accessing health coverage. These marketplaces were designed to be a digital location that people seeking individual health coverage could go to shop for plans. It's not to say you couldn't buy plans outside of it, but it provided an organized venue. And that did allow for some standardization of methodologies as well for people to compare plans. So there were some established tiers to these plans that were made to try to allow people to better compare plans directly to each other. You and your viewers, John, might be familiar with gold, silver, bronze, and platinum plans. These are, without getting too much into the weeds, those categorizations were typologies that were used to provide some amount of standardization and comparability across those plans. So the people knew what they were looking at when they were looking at the cost and a plan. And then third, recognizing that there's been Medicaid expansion, right, coverage for adults, and there's also these marketplaces. But there are likely going to be quite a few people who had incomes that were too high to be on Medicaid, but were too low to be able to afford the plans on the healthcare marketplaces without help. So the Patient Protection and Affordable Care Act created the premium tax credits. which individuals enrolling in health insurance plans on these state-based marketplaces, because they're all based in certain state geographies, although some are run by states, some are run by the federal government. Um, People can use these healthcare premium tax credits to help cover their monthly insurance payments. And the target income range for these is for these tax credits is for people who have incomes at the federal poverty guidelines or up, so 100% of poverty, or up to 4 times that level. And the benefits ramp down as income increases, right? So it's not a sudden cutoff, it's a sliding scale, and those benefits are highest for people who are closest to that federal poverty guideline level. So those were the pre-existing tax credits under the Patient Protection and Affordable Care Act. The 2021 American Rescue Plan Act extended the tax credits to provide more assistance in the aftermath of the COVID-19 pandemic. The Kaiser Family Foundation estimated that the number of people eligible for these premium tax credits with that expansion under the American Rescue Plan Act increased 20% nationwide. So a fair number more folks were able to access coverage, including people over that 4 times the federal poverty guidelines levels. Subsidies were also boosted for people with lower incomes. People who were already eligible before received a little bit more help. So let's use a few examples that are New Hampshire-based examples of this and what it meant for households. So using analysis from 2021, the Center on Budget and Policy Priorities estimated that a New Hampshire couple comprised of two 60-year-olds with a household income of $75,000 would see their premiums drop by about $985 per month because of these enhanced credits under the American Rescue Plan Act. Another example, a family of 4 with $120,000 in income, two 40-year-olds, one 10-year-old, and one 5-year-old. Those would see that household would see their monthly premium drop an estimated $291 per month. And separate set of calculations from 2021, the Kaiser Family Foundation estimated that the average cost decrease for a benchmark plan premium for a 60-year-old in New Hampshire with $55,000 in income would decline by an estimated $317 per month. So we're talking about across a wide variety of household sizes and incomes, pretty significant savings in terms of out-of-pocket costs for these households. And that expansion of these tax credits that took effect in 2021 also was in effect in 2022 from the American Rescue Plan Act. And then the Federal Inflation Reduction Act, which passed in 2022, extended these credits for 2023, 2024, and 2025. Now, without congressional action, those enhanced subsidies will expire after 2025 and revert back to the Affordable Care Act's original formulae for credit eligibility and amounts. So there's a lot there. There's a lot of history there that got us to this point, but that's the crux of why 2025 is an important year for deciding whether these enhancements to those tax credits will be extended into future years.
And thank you for that example, Phil, because that is a portion of our population, as we have an aging population in New Hampshire that has the greatest peril in terms of healthcare costs, right? Because before they're able to access Medicare, they're in that kind of gray space that the cost of healthcare goes up higher and higher due to their age. And sometimes their income isn't there, or they're not able to be able to access that healthcare. And it puts them in a real predicament, right? These are people who may have more health issues, but now can't access preventive care easily. And so these enhanced tax credits really help to smooth that transition out of having access to care that we didn't have before. So it would impact a lot of people in the state if it were to go away, and businesses, obviously. So I wanted to ask, what are the biggest challenges to folks in New Hampshire that they face when it comes to accessing affordable health care? And what solutions could help keep coverage within reach of most people?
Yeah, so I think it's important when we're discussing access to health care in the state that we acknowledge that the availability and accessibility of services is a significant challenge for a number of reasons, including because of workforce constraints. That's the overall workforce constraint, as well as workforce constraints in specialized services. There are only so many people available that provide some of these specialized medical services, or even, somewhat less specialized, but still very much in need. But cost is a significant barrier for many individuals and families. Spending on medical costs was expected to consume about $9,200 out of the budget of a New Hampshire household with two adults and one child in 2025, and that's according to the Massachusetts Institute of Technology's living wage calculator. So, $9,200 is a pretty significant amount of money, right? When we're talking about the cost of the out-of-pocket costs, if you will, of medical care for a year. So that's paying for health coverage, but also what other medical needs do you have, co-payments, deductibles, et cetera. Now, the expiration of the expanded tax credits might significantly raise this amount for some families, particularly families with lower incomes, as there may be more out-of-pocket costs depending on the coverage that's available. The Kaiser Family Foundation noted that they've documented in their research that since these expanded tax credits took effect, many more people have signed up. If you look between 2020 and 2024, the total number of people with Affordable Care Act marketplace coverage increased by 88%, while enrollment that was subsidized through these premium tax credits was up 106%. And people with low incomes have been the largest source of increased enrollment. So that indicates that it's not just the expansion of eligibility of these tax credits that has helped, but it is the enhanced subsidies, particularly targeted at individuals and families with lower incomes, that has likely made it so that previously they couldn't afford it, even with the premium tax credits. The enhanced premium tax credits has likely made it so more people who were previously eligible but weren't receiving enough assistance are actually able to afford health coverage and enroll in these marketplace plans, which again is not, it's publicly subsidized, but it's not public health coverage, right? This is not Medicaid. This is private health insurance, but those enhanced subsidies have made it so that more people, they appear to anyway, have made it so that more people who were previously already eligible can actually afford to enroll and pay for that coverage.
And I've seen your figures as you estimate that overall budget for a New Hampshire family, especially younger families starting out, how much has to go to childcare, how much has to go to housing, how much has to go to groceries, and healthcare is a big portion of that. And if that price gets bigger and bigger, there are consequences. And as New Hampshire tries to compete to bring more young people here to work and start businesses, and in many cases keep our young people here, because we're a net exporter of young people, which is not a good place to be. Affordable, accessible healthcare is really important, especially as we know in our rural communities where hospitals struggle. And if a greater portion of their population were to become uninsured, those hospitals and clinics would struggle even more and really endanger our economic stability and viability going forward. All right. Well, my final question. Sorry, you were about to say something. I didn't want to talk over
But
you.
I was just going to mention that you mentioned the broader economy a little bit there. When we're talking about the enhanced subsidies saving hundreds of dollars per month, that has an impact on family budgets, not just in terms of the fixed other things that they're able to afford or that they're able to spend money on, but it is economic stimulus, right? These are dollars from the federal government that are coming into the local economy in New Hampshire and allowing particularly households with lower incomes to be able to afford more goods and services in the economy. Most of those are going to be in the categories of needs, right?
Yep.
Especially when we're talking about households with very limited means. But it does allow for more economic opportunity more generally for small businesses, for rural economies. There's quite a bit of evidence, for example, around food assistance, providing a very effective economic multiplier, as well as unemployment compensation, that's assistance to people who have lost their income, right? Those are some of the more effective ways that that the federal government can stimulate the economy, and these targeted tax credits do provide more assistance to, in some cases, the same sets or similar sets of households in terms of their economic profile.
That's a really good point. So we talk about offsetting the impacts of recent bouts of inflation. We talk about the price of eggs. We don't often talk about how much a pair of glasses cost now compared to 5 years ago. And those are choices that parents have to make for their kids. And which brings me to my next question as we look at all this, how can we as community health members, as healthcare providers, as policymakers, how can everyone work together to ensure that rising healthcare costs don't force people, our neighbors, to lose coverage or worse, forgo necessary care, not fill a prescription, not go see a doctor for a checkup? What can we do? How can we work together based on what you've just told us?
And so if there are fewer federal dollars available to directly lower costs for people, like say that's, for example, let's say the enhancements to the premium tax credits expire, then finding other ways to creatively reduce barriers to care can help people access services. And I say creative because it's not necessarily just cost or just directly health costs. It could be something like public benefit navigation services or benefit navigation services outside of public benefits, simply helping people with paperwork, including applying for existing services for which they might already be eligible, is often a low-cost way to leverage existing resources to help people, whether it's afford health coverage or find other ways to access health coverage and health services. That is, sometimes a very low cost for the benefit that it's supplied, particularly not just to that household, but to the system overall. So, for example, if someone sees their out-of-pocket health insurance costs go up, but they're eligible for food assistance and not enrolled in that food assistance, for example, through the Supplemental Nutrition Assistance Program, which in New Hampshire is still called the Food Stamp Program, having help with food costs, right? If they were to enroll in a SNAP assistance, receive those food assistance dollars, and have that help with food costs, then when you're thinking about that household pie chart in terms of what are the cost pressures on households, if the food costs are a little bit easier to afford, that might make it easier to afford health coverage, right? So that's the sort of creative solution that people could apply to try to figure out what are different ways that you could support household budgets and also support household access to services, again, because the paperwork is often a challenge, right? And people
Hmm.
also don't know that some of these services are out there and that they might be eligible for them. That's where spreading information and again finding creative ways around some of these barriers could help people access health coverage and health care. And additionally, state policymakers will likely have to navigate other federal policy changes as well. As we've discussed, this is not the only significant fiscal policy decision on U.S. Congress's plate this year. So depending on those policy changes, state policymakers could take steps to help ensure continued access to care, particularly through working to maintain or enhance Medicaid coverage, or through other supports that are targeted at bolstering the healthcare workforce. The state has made some significant efforts in the recent past on that front. Continued efforts there to support the healthcare workforce in New Hampshire means that the access to those services that may be more restricted because of those workforce constraints, some of that could ease. Even if you're not able to directly get at the costs, you can at least get at ease of access in some other way.
Well, thank you. And this, again, we've been having a conversation with Phil Sletten, who's a research director for the New Hampshire Fiscal Policy Institute. I really appreciate this. It's a complex issue. You've unpacked a lot of information that shows us the benefit of these tax credits in helping New Hampshire working families, businesses as well, access healthcare that is substantial for their families and is preventive, which is very important because checkups, vaccinations, all these things, catching something early is much better than catching something late. And obviously, we all care about our neighbors, we care about our communities, and we want to see New Hampshire thrive and grow. And it seems like this is one way to do it. So it sounds like one of the things we need to do is to let our congressional delegation know that we support these tax credits. And the other thing to do is to let our officials in New Hampshire know that it means a lot to us, be it our Chamber of Commerce or our state representative or a state senator, let them know how this program has benefited us as a state, because it's really easy to take stuff for granted sometimes. And then when it goes away, it's really hard to bring it back. So this is here and it sounds like it's working. And we see from the numbers that it's had an impact on our state, not just in terms of our economy, but in terms of our overall health, because there's some really good plans on the exchange and it's done a lot for folks. So on that high note, I'm going to ask my colleague Rachel. We've had a couple of folks from the media join in this conversation. Rachel, were there any questions for Phil that we wanted to share?
Thank you, Jime. Yes. So before we get started with that, just wanted to say thank you for joining us, everyone, both the press and to you, Phil. If for our Q&A session, for you, those who have questions, you can drop those in the Q&A box. And if, it's a question specifically for Phil or for Jime, you can specifically say that. We do have one question just to start us off, though. Um, and Phil, I think this is a question for you. Um, That is, how will a loss of EPTCs particularly harm rural communities in New Hampshire? And how do you see this harming these communities and their economies in the long term?
Yeah, it's a great question, and I don't have a nice, neatly quantifiable answer for you on that, but I can say a couple things. One is that speaking to the economies more broadly, we've seen that with estimates of SNAP benefits, so supplementary nutrition assistance benefits, food assistance, those are also federal dollars that go to support households and cover in this as opposed to their health costs, it helps cover their food costs. We've seen economic research that shows that those are more beneficial in rural areas. They're already beneficial in terms of providing roughly $1.50 of economic output for every dollar invested in it. It gets money into the local economy quickly because people use those food assistance benefits to spend money at local grocery stores. The in rural areas, that multiplier effect is even larger. There's some evidence that it's even larger because of sort of the outsized value of that dollar, and also that dollar, if that dollar is not there, there's maybe less economic opportunity for people to be able to easily access either enhanced employment or other services, whatever it may be, in a rural area as opposed to in a more metropolitan area. So that's at least some research that speaks to the food assistance benefits that are associated with targeting resources to households with lower incomes in rural areas. There's also, when it comes to providing private health insurance coverage in rural areas and helping people afford private health insurance coverage, to the extent that those are higher reimbursement rates for local healthcare providers in rural areas, that support may end up bringing more dollars to rural areas than would be otherwise if, for example, if an individual couldn't afford coverage, then they're trying to pay for it out of pocket. Or if they couldn't afford coverage but have a low enough income that they may be able to access Medicaid in some form, that may still be a lower reimbursement rate for a local hospital or a local healthcare provider than having a private health insurance plan. So there you can see that there's a potential for those lower reimbursement rates or a lack of reimbursement if it's someone who's unable to afford coverage and doesn't have an income low enough to qualify for Medicaid. That lack of reimbursement in its entirety could put more stress on rural healthcare providers who may be more reliant generally on a mix of Medicare and Medicaid dollars than those in more metropolitan areas.
Thank you so much, Phil, for that really thorough answer. I really appreciate that. Um, we have one more question, and this is actually for Jime. And that is, how have the enhanced premium tax credits under the ACA positively impacted you and your family? And what do you see as some of the consequences if they are taken away?
Well, I can answer that one simply that we have a member of our family who has a lot of eye issues. And unfortunately, most of the healthcare plans on the exchange don't have optical healthcare coverage attached to them. Only one does, and it's the top level gold plan from Ambetter. So that's the plan we have to get because we have a member of our family who needs a lot of help there. And with the help of these tax credits, it lets us access that much more expensive plan because it saves us money in the long run because then we're able to go see the eye doctor and the procedure has to be done. We're able to get that. And that's, not only peace of mind, it's made healthcare a lot more affordable. It's just a few $100s a month, but it certainly helps because it lets us step up to a plan that meets our needs that we wouldn't be able to easily access if it wasn't for that. Um, so, it's every little bit, I think, when we look at healthcare, because there's so many unknowns and what out-of-pocket expenses you're going to face and what referrals you're going to be able to access. So I'm very, grateful to President Biden for having extended that. And I personally am hopeful that the Congress will be able to look and see that, this is a broad range of support for people all throughout our economy, helping to be productive and helping to stay healthy, which is, I continue to believe, something that is crucial to our communities and to our economy.
Thank you so much. Now those are all the questions we have for today. So Jime, without further ado, I will turn it back to you.
Well, thank you, Phil. Thank you, Rachel. Thank you for those who joined us. I think two things have come up, which I think we should look for future discussions. I think the impact of the Affordable Care Act on rural healthcare in New Hampshire, something we could ask Phil to discuss more and bring in some folks around the state to look at as well. Also, one of the things I know that the ACA has been helpful in addressing in terms of funding rural health centers, but hasn't exactly stopped the loss, which is the maternity desert that we see forming in the state right now. So I think that's something we could take a look at, because if we were to see cuts to Medicaid, that might exacerbate a problem, which I think has been growing. So on that unfortunate note, let's say thanks again, Phil. Thank you, Protect Our Care New Hampshire, and to everyone who's tuned in. We're going to keep these discussions up, and we're always looking for feedback, input, and other stories to share. And Phil, thanks again for joining us. I look forward to having another conversation soon.
All right. Thanks for the opportunity. I appreciate it.
Take care. Thank you, everybody.